processes of responding to bureaucratic processes that do not support emergency response to outbreaks. I know one of the investment that Kofi is doing is, we do not know when is the next outbreak going to happen, in which place. I think that's where you have got the worry and the challenge, how can we support this country? But you do not know when is the next outbreak going to. If we can support the system that is able to detect the next challenge. But there has been challenges on how can we commit resources when there is an outbreak, and that has been the main challenge. Then the delays in the procurement, which we have tried to address using some of the partners like UNICEF, that we have said in year 2, you are able to use UNICEF. But also our good partners being WHO in procuring some of the things. Then the surveillance priorities are dynamic. Today you might think about Kampala, and Kampala wakes up and there's nothing in Kampala. There's a different outbreak, it may be in Chotera. And yet the scope of our support may not be in regard to Chotera. And that leaves us with a dilemma on how can we support, because the Ministry of Health and the department has the mandate to respond, first of all to detect and respond to these outbreaks. And yet, today you have planned for one in Nakasongola. Nakasongola has not had an outbreak, instead it is a Busia. So it's very dynamic, and I pray that people who handle the Department of Surveillance actually understand our challenges in terms of the dynamic ability of the department and the outbreaks that we have. Okay. By and large, we have got success stories that from the support that Kofi has given us, and that we said we are able to train the VHTs on community-based surveillance and One Health. Remember, in year 1 and 2 and 3, One Health has been our cornerstone, and we are able to learn that even these alerts and events that happen in the community can come from the team from the environment or even animal health. Then, of course, we have learned that we need to work with the other partners like UNICEF to have other systems embedded. And then, of course, we have got a new system like ICHIS, which is interoperable with other systems. And that has actually translated into support in the community. And then lastly is about the information being reflected. Whatever we receive right now, you can actually pick them from the DHIS tool. Okay, next. So our best practices is that use of the IDSR technical guidelines produced by Kofi in Masaka region has improved the ability of the health workers to refer to those documents whenever they would want to identify challenges in the community. And then also reporting of alerts by the community that we are trained on notifiable diseases has actually translated to an improved index of suspicion for some of these priority diseases in our communities. Then the trained DRRTs are being deployed as fast responders. Remember, sometimes there are no funds, and we bank on these people who are already trained to be deployed. I know my bosses are here. Sometimes you are just required to move there. The rest can follow later, and you use the basis of the capacity that you have benefited from. And indeed, Kofi supported that. Then the regular analysis of surveillance data that has improved the timeliness and completeness of our information and reporting. Then the last one is the use of standard case definition at the committee and the facility level has improved the detection ability of our healthcare workers and the community. So the balance that has remained, we feel it is our request and ask that if it can be used to support IDSR in PNFP facilities in the 10 cities. The cities are equally very dynamic. If the funding can actually support the 10 cities, the IDSR training and response in the 10 cities of this country. These cities have been created newly, they do not have capacity. Some of the systems that are there are actually not up to date. Then the second request is that if it is possible, we cascade community-based surveillance to currently in year 4 from the report of the consultants. We were advised to move to the Soga region. So if we can be supported and we build the capacity of the community,